Hi everybody, this is a quick video about one of my favorite topics, low-dose immunotherapy, also known as LDI. I've posted a number of videos about LDI before. If you go to my YouTube account, I have a 45-minute lecture recording all about low-dose immunotherapy. It's one of the first videos that I ever posted many moons ago, and if you want to learn more about the details of it, please check that out. So I wanted to post this quick video because I love LDI for so many reasons, not the least of which is it's such a great therapy option for patients who are really sensitive to things. In my practice career, I've worked with hundreds and hundreds of patients who are sensitive to various supplements. Some are incredibly sensitive where they can barely tolerate anything. It seems that, like supplement or herbs and vitamins and minerals and things like that. The nice thing with one of the nice things about low-dose immunotherapy, aside from the fact that it's, relatively speaking, inexpensive, it's versatile, etc. If a patient's flaring from a given dose of LDI, we can always make use a more dilute formula, or a more dilute version of that formula to kind of lower it down to the dose that works for them. It's not like, say, building up on an herbal tincture or some other herbal formula where we need to typically get to a certain dose in order to have a chance of actually killing off the microbes. With low-dose immunotherapy, a good analogy is it's kind of like tuning an instrument, like tuning a guitar. You don't want to tighten the string as far as it'll go. You don't want to make it as loose as possible. You need to find just the right pitch, so to speak, so that it sounds good. And similar with low-dose immunotherapy, if the dose is too high, we lower it down until we find the dose that's helping. If the dose is too low and not doing anything, we raise it until we find the dose where it's helping. So the case that inspired this video is a patient of mine. Many health concerns. Basically, name a health concern or a symptom, and she was affected by this. She has an underlying autoimmune disorder, digestive issues, just the list goes on, and she's very sensitive to boot. So thankfully with her, we found a good combination of herbs and supplements and things like that to help support her system, and she's gradually getting better. Mold toxicity, chronic infections, whole bunch of stuff going on. But at a certain point, it seemed like, well, she is just kind of seemed to hit a bit of a threshold or a saturation point of what her body seemed to be okay with taking in terms of traditional supplements and herbs, etc. So I recommended that she try low-dose immunotherapy. We started with some pretty darn low dosing. And lo and behold, we found a formula. It was the Borrelia formula for the Lyme disease causing bacteria. Made a big difference with their energy levels. That was great. Eventually tried the Mycoplasma formula. That made a big difference with helping with cognitive function and brain fog. Dropped dramatically, etc. We worked with some Bartonella, some Babesia. It's a patient where, again, like lots and lots of different infections, co-infections going on. And so we wound up needing to phase in multiple LDIs, but it seemed that each LDI that we brought in helped with a given symptom and just really helped to move her case further in the right direction. And again, cost-effective therapy, is well tolerated, so just as valuable as all of the other supplements that she was working with up to that point combined, just bringing in this low-dose immunotherapy. So just wanted to post this video, just a little shout out to low-dose immunotherapy. It's a wonderful treatment. There are differences in the way that different clinicians use low-dose immunotherapy. I kind of have my own rendition of it that I think is a bit unique compared to sort of the traditional way that it's done, but that seems to work the best for my patients, and I've been really happy with it. So I hope this video was of interest. If you have any questions about this topic or anything else, just post it in the comment section below. If you yourself have used low-dose immunotherapy or have some feedback about it, please consider posting that in the comment section as well. I'd love to hear what you have to say about it. Not a lot of patients access LDI because not a lot of clinicians are trained in it. And so it's always valuable to hear what other folks have had, what other experiences folks have had with it. So I'll leave it there for now.